Hello, I'm Judy, and today we're going to be demonstrating a skull series. We're going to be doing 4 projections in the wall bucky at 40 inches. So I'm going to go ahead and detect my tube at 40 inches. We're going to be using a 10 by 12 in the wall bucky in the landscape orientation. We're going to be doing 4 projections today. We're going to be doing the lateral, the Townes, the Caldwell, and the SMV. So now that our room is set up, we can go ahead and grab our patient. Miss Stump?
Yes.
Hi there.
Hi.
I'm Judy from the
Hi.
X-ray department. We're going to be doing your X-rays today. Can you verify your first and last name for me, please?
Kylie Stone.
Okay. And when's your date of birth?
November 8th, 1991.
Okay, great. So right this way. You're going to come into this room. All right. Is there any possibility of pregnancy?
No.
No? Okay. So what brings you in today?
I had a cheerleading accident and I fell on my head.
Oh, okay. So,
Yeah.
all right. So we're going to be doing some pictures of your skull today.
Okay.
What we're going to have you do is you can stay in your outfit. You don't have to change. But I do need you to take your hair clip out, any bobby pins, jewelry in your face.
Okay.
All that needs to come out. Any dentures or hearing aids also need to come out.
Don't have any
Okay.
of
So
those.
then just your hairband, and we'll get started.
Okay.
All right, so the first projection we're going to be doing is the lateral. You can do a left or right lateral, however, I've chosen to do a left. So we've had our patient sit down on a chair in the LAO position. We're still using the 10 by 12 in a landscape position at 40 SID. So our patient is sitting in a lateral position, head up a little bit with the MSP parallel with the wall bucky, the interpupillary line perpendicular to the IR, as well as the IOML line is also perpendicular to the front edge of the IR. Our central ray is going to be 2 inches superior to the EAM. I'm going to shield my patient, and we're also going to use a left marker to indicate that the patient's left side is on the IR. We also just make sure that we have the entire skull in the light field. On my console, I have set 85 kVp for about 6 to 8 mass, depending on the size of your patient, on the wall bucky. All right, so just don't breathe, don't move, X-ray. Okay, now we can move on to the next image. So the next projection we're going to do is the AP axial, also known as the Towne method. Because our patient is able to extend her neck down, making the OML perpendicular with the IR, we're using a 30-degree caudad angle. I've also shielded my patient. We're using a 10 by 12 portrait. Our central ray is going to be 2 inches superior to the glabella. The MSP as well as the OML, is perpendicular to the IR, and we've marked it with our patient's left side. The technique that I've set on my console is 85 kVp, 14 to 16 mass. Okay. The next projection is the PA axial projection, also known as the Caldwell. So we have positioned our patient with her forehead and nose touching the IR. We have had our patient with the IOML perpendicular to the IR. We are using a 15-degree caudad angle with the 10 by 12 portrait orientation IR. So the 15-degree caudad angle is exiting through the nasion of the patient with her IOML perpendicular to the IR. And we also have shielded our patient, and we are using our right marker to indicate this is the patient's right side. Also, we're using a technique of 85 kVp of 14 to 16 mass. Okay. Our last final projection is the SMV, also known as the Schuler method. For this projection to position our patient, we are going to get the IOML parallel to the IR and the MSP perpendicular to the IR. Our central ray is going to be perpendicular to the IOML at the MSP of the throat between the gonian, passing through a point 3/4 inches anterior to the EAM. So I'm going to go ahead and position my patient, still using it 10 by 12 in the portrait orientation. I have shielded my patient. We're using an SID of 40 inches still. I'm going to place the patient's head backwards in a position. This is the left side of my patient. I'm just going to get her centered. Okay, make sure I get the whole head, and I'm just going to. Okay, the technique I'm using is 85 kVp at 28 to 32 mass. Okay, don't breathe, don't move, x-ray. Okay, that's good. So here we have the lateral projection of the skull. So the central ray for this is 2 inches superior to the EAM. You can see some of the structures shown or are the sella turcica. There's evidence of proper collimation, and we know that there's no rotation or tilt of the cranium because there's superimposed mastoid regions and of the EAM, superimposed TMJs, and there's also no overlap of the cervical spine by the mandible. Overall, this is a good image. So here we have the AP axial projection, also known as the Town method. In this image, we change our caudate angle depending on whether the OML or the IOML is perpendicular to the IR. If the OML is perpendicular to the IR, we use a 30-degree caudate angle. If the IOML is perpendicular to the IR, we use a 37-degree caudate angle. So here we have symmetrical petrous ridges. We also see the posterior portion of the foramen magnum, and we also see the dorsum sellae lying within that. There's good penetration of the occipital bone, and there's no rotation. This is a good image. So here we have the PA axial projection, the Caldwell method. This is the image that we took using the 15-degree caudate angle exiting at the nasion. We're most concerned about the frontal portion of the skull, the frontal bone, frontal sinuses. In this projection, we're looking to demonstrate the petrous ridges lying in the lower third of the orbit, which is seen here. We want good penetration of the frontal bone. We don't want any tilt or rotation of the cranium, and of course good proper collimation. And so we have frontal sinuses, the crista galli right here, the orbits. And so overall this is a good image, the PA axial Caldwell method. Lastly, we have the SMV, the submento vertical projection. This is the one where the head is tilted back. There is evidence of proper collimation, and we're looking at the bottom portion of the skull. You can see the mandible, the bony nasal septum. We also have the dens in the odontoid process right here, as well as the occipital bone. So yeah, this is pretty good. Maxillary sinuses, ethmoid air cells. And this is what this should look like.